The problems generally for the male pattern hair loss start at puberty. The basic problem in both men and women is the same. There is shrinkage in terms of the caliber of the hair. So the hair becomes thinner over a period of time.
Hello and welcome to Beyond Skin, a skin initiative by Derma, where we dive deep into the world of skincare, trends, and everything in between. I'm your host Shruti, and today I'm very excited to introduce a very special guest with us, Dr. Sandeep Sattur. Dr. Sattur is a successful hair transplant surgeon with over 20 years of experience, and today he will share some amazing truth about hair fall in your 20s and 30s, myths, facts, and what actually works. Hi, sir. How are you today?
Hello. Nice to be here, Shruti.
It's amazing. I'm very happy you're here with us today. And, before the shoot, when we were talking and you said why you are in this field was something that inspired me more to have this conversation with you. So, again, I know we have already had that conversation, but if you would like to share with us viewer, what is your true inspiration behind, coming into this field?
See, as you know, my core training is of plastic surgery. I'm a plastic surgeon and have been in practice since 97, 98. Hair transplant was in 98. So it's been from that time that I've kind of got involved with hair. But the hair follicle as a miniature organ is a very interesting biological organ, which I feel is one of the reasons that inspired me to stay with this particular organ and work on addressing the issues that come out of the malfunction of this organ. So creating hair for replacing hair either medically or surgically for a person who has less of it or has lost it gives me immense satisfaction, and I try my best to see that I can deliver and help patients or people with this issue of hair loss or hair fall.
So why do you think individuals in their 20s and 30s experience hair loss?
Actually, there is no simple answer to this. One thing that you must understand that hormonally things start changing around puberty. So puberty to adolescence is the time when hormonally things are changing. You have got genetic traits from your parents, from either side, maternal as well as paternal. And these genetic traits come into play once the level of the hormones rise for sexual maturity. And that is when the problems can start.
Okay.
Like when I am specifically addressing the issue of male pattern and female pattern hair loss. The problems generally for the male pattern hair loss start at puberty, though they may not be very obvious. But a decade down, when the person is in the 20s or late 20s or early 30s, it starts manifesting more obviously, and that is when a person starts noticing these things. But the problem has started at puberty, when the level of the male hormones starts rising. So the fascinating thing here is that if you look at hair follicles on our body, we are endowed with close to 50 lakh follicles on our body, out of which only 1 lakh is on our scalp. So the follicles that are on our face, let's say in a male, on the face, you don't see young boys having facial hair.
Right.
But when they hit puberty, those follicles which have the androgen receptors or the male hormone receptors start responding to the rising levels of the male hormones. So the same hormone which increases hair growth on the face and the body is the same hormone that is responsible for downgrading the hair on the scalp.
Oh.
It is a paradox that is quite unique to the male pattern hair loss. In women, probably it starts much later, late 20s or even later than that. There, the role of male hormone is not so clear, or it may not have a role at all. But there are other factors that work in causing the problem in women in their 20s or 30s.
Mm-hmm. So when I was 16, I think there were some issues as well. Like, I only had one friend and she moved and I did not have any friends. I did not know how to deal with that. So I kind of went into a little depression.
Okay.
So that caused me, during that time, I started losing a lot of hair as well. So does that also...
Okay, now just to be sure, hair loss and hair fall are two different things.
Right.
They should
okay.
not be confused.
Okay.
So what you experienced, probably, since I have not examined you, I don't know, but hypothetically speaking, stress at a psycho-emotional level or even at a physical level can change the ratio of growing hair to resting hair. It is the way the hair cycle functions in all hair follicles.
Okay.
So when this ratio changes, the daily shedding that is to happen changes. So you will see a lot of shedding.
Right.
Generally, this is a self-limiting thing and it reverts back to normal once your period of stress is gone.
Right.
So there was in fact an interesting study where they found an incidence of increased hair fall in young girls who were preparing for the exams. So they actually quantified this, and this is also linked to the fact that they have tried studies in mice, create stress for the mice, and they have tried to find out whether there is an increase in the shedding, and there is an increase in the shedding. So there is a pathway like a brain and hair axis which works.
Right.
Secretion of certain substances increases. Primarily, it's also linked to our basic survival factor known as the fight or flight mechanism, which is an inborn thing. And the moment we are scared or stressed, the body releases certain substances in preparedness for us to be, ready for conflict.
Right.
But the same thing can have a impact on the hair follicle, which the hair follicle cycle changes. You may have a little more shedding, but it will all come back to normal once the stress is over. So it is not a permanent issue.
Right, right. So is it true that more and more individuals from their 20s and 30s are coming to you with hair loss issues?
Actually, the answer to this question is not straightforward. I would say yes, I am seeing a lot of patients in their 20s or even in their teens who come to me to consult for hair fall, hair loss. But if you have to understand this, you have to see why I'm getting more. One is that probably awareness on these issues have gone up very high.
Right.
Could be the social media, could be the availability of information on internet. Everything has primed these young people to understand their body image, and they will pick up smaller things that they would have not picked up if they were not aware of it.
Right.
So it's like, eyes don't see what mind doesn't know. So it is something like that. So now their mind knows that these are the issues. They start seeing them and they present to the doctor earlier. Also, from an evolutionary perspective, if you see, we have evolved from the apes. So apes had a lot of hair all over the body. But as we have learned to take control of our environment to suit our needs, whether it is protecting ourselves from the cold or, using the air conditioner to improve our temperature. So all these things were not possible. Hair was primarily meant to have a kind of an insulation for the body. Now we can do that on our own. So nature doesn't feel that it is necessary. So technically, from a functional perspective, hair is vestigial. But it is important for psychosexual communication from a body image perspective. It is important. And that is how the emphasis has come. So there is a possibility that as we evolve further, we may have less hair. This is my understanding. And also the fact that increased awareness about body image is making people present a little earlier to the doctor with issues.
Right. So, sir, how can someone tell if their hair loss is just temporary or a sign of something which is deeper?
Hair fall and hair loss, again, these are the things that I will come to. Hair fall can be a manifestation of something that is systemic or something deeper.
Okay.
Hair loss also can have implications like that. Now, when we see a patient who has come to us with a complaint, we have found that especially in women, and especially women in the fertile age group, will always have, or a lot of them will have issues with their iron stores. So classically what I have seen is non-anemic iron deficiency. So they may not be having frank anemia, but their iron stores will be low. And the hair follicle is a metabolically very active organ. It
Okay.
needs a lot of
Iron.
nutrients and minerals to function optimally. And like I said, from an evolutionary perspective, the body is programmed in such a way that hair is not important. So
Right.
even if there is a deficiency, the rest of the body may not feel it, but the hair can get impacted. And that is the commonest reason that is seen cause of hair fall in women.
Okay.
And especially vegetarians, vegans, women in the fertile age group, we see this often. Means I'm telling you from what has been over 2 decades of experience in understanding this. But if I have to differentiate between hair loss and hair fall, let us say baldness, or it is also known as alopecia. It's a generic word for baldness. This can be due to 2 reasons. One, the number of hair have reduced, so the scalp becomes visible, or the caliber of each hair also reduces and the scalp becomes visible. So what we see in male pattern and female pattern hair loss is reduction in the caliber. So something that was, let's say, 100 microns in thickness drops to 20 microns. So there is a 80% drop. So obviously,
Right.
if that involves 50% of the hair on the scalp, it will still show the skin. On the other hand, when you shed hair, by virtue of what is this shedding of hair is known as effluvium,
Okay.
the hair being shed. So if there are more hair in the resting phase, then it is known as telogen effluvium, which is triggered by fever, by anemia, by thyroid dysfunction. So all these things, if they start a few weeks after the onset of this problem, you will start seeing the hair fall. Like suppose you had a viral fever for about 4 or 5 days.
Right.
4 to 5 weeks later, you will start shedding hair.
Oh.
That is how it works. So when you say something deeper, when I look at a patient with hair fall, I will always look for a cause in the body which is causing this manifestation in the hair. But if
Right.
there is reduction in the caliber, that is technically a genetic thing which has progressed as the person is aging.
So does weather also has something to do with it?
See, this is very interesting because man is a mammal.
Right.
All mammals have hair that responds to seasons. So these mammalian traits of hair, though the difference between the human and other mammals is that humans have asynchronous hair cycles. Asynchronous means we have follicular groupings where one hair will be growing and the other will be resting.
Oh, okay.
While in animals, it is a molting cycle. Suppose if you have had a pet at home, like a cat or a dog, you will see that they shed hair periodically. So
Right.
they have a summer coat which is replaced by a winter coat and so on. And one of the reasons that has been speculated to cause this is the changing daylight hours that is responsible for this. So we have found that melatonin is an important substance which kind of manages the hair growth cycle. So when you have shorter days in the winter and longer days in the summer, so the melatonin secretion also changes.
Okay.
And that is the reason you may have a change in the hair growth cycle. And that is why you may have shedding. In animals, it is a molting cycle. It starts shedding from the head to the bottom.
Right.
They will shed and they will regrow the hair. In humans, it may not be very obvious, but it may be possible that in some patients there will be some more hair fall and some there may be no hair fall. And it is important for us to know this and guide the patient accordingly. So seasons, yes, they can have an impact.
So, sir, what are the exact differences between hair loss pattern of male and female?
I think you're alluding to the fact that male pattern hair loss and female pattern hair loss.
Right.
There are differences from the age of onset. When does it start? It starts much earlier in men as compared to women that I explained earlier. The pattern of hair loss also is different. In women, their hairline is persistent. The hairline doesn't go. There is thinning that is in a diffuse nature behind that. So
Okay.
there are various grades that have been looked into by different authors who have classified and graded the severity in different manners. But the concept is that the hairline is preserved and there is thinning behind that. Rarely, some women may have the frontotemporal recession that is typical of men. Now, men start with recession in the frontal and temporal areas, and they can have thinning in the crown area or the vertex. So, there typically, as per the classification that is widely accepted, is there are grades of hair loss, 7 grades of hair loss, which are graded on the basis of the recession that is seen in the frontotemporal region and the balding in the crown area. There are some who may be different from these standard deviations, where you may have diffuse thinning all over, even in men.
Okay.
Now, we have to look at the basic problem. The basic problem in both men and women is the same. There is shrinkage in terms of the caliber of the hair. So the hair becomes thinner over a period of time. That part is the same for both men and women. It is just the manifestation of the pattern of hair loss is different. Moreover, where men and women are concerned, now because they lose the hairline and they generally sport shorter hair than women, they cannot camouflage it. Women, because by virtue of longer hair and diffuse thinning behind, by changing their hairstyle, they can camouflage till it really becomes very severe. So this is another difference that we see. So one of the reasons that we see the pattern of hair loss being such, their candidacy for transplants also is different. So in male patients, because of the loss of hairline that needs to be restored via transplant, they are obviously more eligible for a surgical intervention like a hair transplant. In women, they can get away with camouflage. But yes, today, like I said, because of the increased awareness, even restoring or augmenting the hairline, they want stronger hairlines.
Right.
They do come up for this. But your question about the patterns, yes, the patterns are different, but the endpoints, why the hair loss has happened, is the same.
Is the same. So I have one more question on that. We were just talking about hair thinning. So is hair thinning natural or does it happen because of lifestyle or diet?
See, diet, I don't think should be blamed first.
Okay.
It's primarily thinning. If it is happening, it is because of the genes that you have inherited. And we have traits that can come from your mother's side of the family or father's side of the family. Today, in fact, we know that there are over 600 genetic components which can express the way your hair behaves.
Wow.
So it is basically in your genes. There is something known as an epigenetic change. So your lifestyle can impact the way your genes express. So lifestyle habits like smoking or having a very poor diet. Poor in the sense, lot of calories but low nutrition. So that is the diet that I'm talking about.
Right.
So basically, a lifestyle issue where the whole spectrum of metabolic syndrome that we say can impact the way your genes behave, and that can influence the rapidity with which the progress can happen of your genetic traits. So you already have the genetic trait, and a bad lifestyle can prepone or worsen the whole manifestation. But by itself, it cannot have a very significant impact. So diet is important. If you are having a diet that is poor in essential nutrients like iron and protein, these are I feel, two critical factors that can influence the way your hair behaves. And that should be adequate in most diets. The other thing that we see hair thinning is when somebody tries to lose a lot of weight with something that is known as crash dieting. So what I have observed clinically is that when you drop your calories significantly below 1500 calories a day, we have seen some amount of thinning and shedding that happens in these individuals.
Okay.
And it is a known fallout of sudden loss of weight over a very short period of time. And that is why we tell patients that do it in a more gradual manner rather than suddenly depriving the hair of calories.
Right.
So your question about thinning is that all these factors can influence, but more importantly, thyroid is one thing that I feel is a low functioning thyroid can definitely impact the thinning in your hair, and these kind of thinnings are a little more refractory to conventional treatments as compared to patients who do not have a thyroid issue.
So, sir, now we are going to bust some myths.
Okay.
So, my first question on that is, does oiling actually help with hair growth, or it's just a cultural thing?
See, this concept of oiling, putting a oil on the scalp and hair is quite a regional and cultural issue. From a scientific perspective, applying oil on the scalp or the hair does not change or alter hair growth or prevent hair loss.
Okay.
It is very clear. There is nothing that can do. But using oil on the hair, specifically when I say using something like coconut oil, can work as a pre-wash conditioner. So you apply oil an hour before you wash your hair. It really helps to give the hair some amount of shine, especially for people who have colored hair. This pre-wash conditioning goes a long way.
Okay.
And in fact, the thing about the word shampoo comes from the Indian word champi.
Champi.
So it is something that it is a regional thing where you massage oil onto the scalp. The thing about massaging oil, so a lot of our patients tell me that they go for a weekly or a fortnightly head massage to the salon. Now, I tell them that it is not a good practice because you may end up pushing certain microorganisms deeper into the hair follicles, which can result in boils or folliculitis, which is not a good thing. See, the muscle is here, and on the back. There is no muscle here. So technically, the massage relaxes the muscle. So the massage is only here, not here.
Right.
So I technically tell them that do not apply any oil on the scalp. And especially if you apply coconut oil, it has a tendency to congeal at lower temperature. It can end up blocking all the pores. So it is advisable not to use oil on the scalp. But yes, you can use it on the hair an hour before washing your hair. Applying it after a wash is like putting a magnet for dust onto your hair. It will just attract all the dust and it will just get stuck to your hair. So the logical way is to use it optimally is just before a wash
As a conditioner.
as a pre-wash conditioner.
Right. So, sir, my next question is, how frequently should someone wash their hair?
This is a question that is commonly asked by my patients, and people feel using chemicals on their hair on a daily basis is actually detrimental to their hair or is responsible for hair loss. Understand one thing, that if I have to decide about hair wash frequency, a lot of factors go into it. One is the person and his or her activity levels. If you are a person who is outdoors, who does a lot of activities like the gym or sports where you sweat a lot, and you are also located in a geographic place where there's a lot of humidity, you need to wash very often, practically daily.
Okay.
But if you are a person who is not really, sweating a lot, and you are in a place that is cold and dry, you may reduce the wash frequency. Now, there is something that you must understand. We have an entire universe or a microcosm of a universe existing on our scalp. This is known as the scalp microbiome. It consists of bacteria, fungus, which are living on our scalp, and they are living harmoniously with our body or our hair. Now, if you use substances that destroy this ecosystem, then also there is a problem. If you don't use the washes regularly, you may build up a pathological ecosystem which can be detrimental to you.
Right.
So getting the right balance in terms of frequency and in terms of products make a difference in your scalp health, which ultimately reflects in your hair health. So I feel that if you are a person living in like a place like Bombay, and where you're going to be sweating even in the months of December and January,
Right.
and if you are having a physically active lifestyle, then washing it regularly is not a problem. Provided you use products that do not have harsh surfactants, milder surfactants, and the pH of the product is very similar to that of the scalp, so the ecosystem doesn't get harmed.
Right. So with that, I have one more question. People like, for example, I wash my hair every other day. So do we create this habit for hair wash? If I don't wash my hair, let's say for 2-3 days, then something weird, like I feel weird.
See, it is because we produce a normal amount of sebum and sweat.
Right.
If there will be some patients or some people with a slightly increased level of sebum production or sweat. Now, if there is too much sebum, some of the fungi that exist on our scalp, this sebum is food for them.
Right.
They ingest the sebum and excrete certain substances which cause irritation to the skin, which ultimately leads to dandruff.
Right.
So this whole cycle can be broken by reducing that level of the sebum. So a surfactant may be necessary to take the dirt and the sebum together and flush it out when you wash it.
Oh.
So washing it is a good thing. Now, the concept of dry shampoos came in because you don't have the time. Now, people with long hair, it's one big event if they have to wash their hair compared to someone like me who doesn't really, it's a no-brainer. You wash it and you move on. But when you have to do it, you need to allocate time for it.
Right.
So sometimes to get rid of the sebum, you can make use of a dry shampoo. Now, dry shampoo basically is nothing but starch or some substitute which will absorb the sebum and you can just dust it off.
Right.
It is not meant to clean. It is just meant to reduce the sebum.
Right.
This concept is not yet popular in our
In
country.
India.
But
Yeah.
for people who are very busy professionally and cannot afford to take time to wash, this may be an alternative to punctuate between the regular hair washes. I don't say that you should do it regularly, but once in a while when you have not, because of professional commitments, you cannot take time off, you can do this. But otherwise, if possible, washing it regularly with the right product is a good thing.
Right. Right. So we talked about oiling. We just had a conversation about hair wash. I want to ask about hair mask. So, hair natural remedies like onion juice or aloe vera. So, does that actually help?
See, hair mask is a different thing.
Right.
Onion juice, aloe vera, these are all applied on the scalp. Okay. Hair mask is thought to be a way of deep conditioning that you should get.
Okay.
This is useful in individuals who have highly processed hair, in the sense coloring, straightening, or coloring, perming, whatever, all those processes. If you have been doing on a regular basis, the hair becomes porous. So it does not retain the moisture, it becomes brittle.
Oh, okay.
So conditioning or deep conditioning will have a way to preserve the integrity of that hair shaft. On the other hand, what we talked about onion juice, primarily onion juice is an irritant. It has got certain substances or chemical actives which can irritate the scalp, and thereby whatever studies that have come from a disease known as alopecia areata. It is an autoimmune disease where you have patchy hair loss. So you cause an irritation in that part of the skin where you have lost hair. The focus of the immune system from the hair follicle moves to the skin, and that is how you tend to get some hair growth in those areas.
Right.
Unfortunately, all these remedies, like there are publications, a lot of things. You will see onion juice, aloe vera, then there is rosemary oil, which is very popular. There is, I think, castor oil, lot of these things. But they do not have enough scientific validation. In the sense, the number of studies that have been done have got very small sample sizes. Means they don't have too many people on whom these studies have been done.
Right.
So to infer something and kind of advise it for a doctor is not fair. So as of now, the way things stand, all these home remedies should not be used till more scientific evidence is available.
Oh, okay.
In fact, most of our patients have asked us about rosemary oil. In fact, rosemary oil has a concoction of a few chemical substances which have various roles. Now, they know this because they have done studies on mice and in vitro studies, like studies in the laboratory. They have found that it has got antioxidant properties, it increases the blood flow and all these things, but it doesn't translate clinically into benefits. So the conventional medicine that is used to treat hair loss is minoxidil, used topically. Now, when you compare it with rosemary oil, there have been some studies that have compared this, but they are very small studies and for a short duration. Now, if I'm going to advise minoxidil or any treatment for pattern hair loss is a progressive problem. As you grow older, it is going to worsen. So you need to treat it for that much period of time. So it's a long-term thing. None of these things will have long-term data for their safety of usage.
Right.
And they are all causing some irritation at some level. So I don't think that these should be recommended or used without any kind of validation scientifically.
Right. So, sir, how big of a role diet plays in hair loss, basically?
See, like I said, the hair follicle is an organ, a miniature organ with very high metabolic requirements.
Right.
So you need to have an adequate diet rich in proteins, iron as mineral, and all the vital vitamins and obviously calories.
Right.
Now, there is no specific diet for good hair. In fact, you can do what you want with your diet. It is not really going to change the basic nature of your hair.
Okay.
But yes, if there is a compromise in the diet, improving your diet may improve your hair. Like I said about people who have iron deficiency, so including more of natural nutrients in your food may go a long way in improving your hair. So I tell patients that it is important to emphasize on protein, but it is not the be all and end all of your dietary requirement. You should have a mix of everything.
Right.
So we tell patients that make sure that you are having a more wholesome food rather than junk, because junk may give you a lot of calories which are not really wanted and be very poor on the nutrient scale. So a nutritious diet is something that is important, and proteins, iron are crucial. From my understanding of hair, I feel proteins and iron are critical. We have seen the person's hair color change when I've improved the iron. When there has been a deficiency, the hair becomes much lighter in shade. You supplement iron and the hair gets a very nice rich color. So there has been this observation that I've had in the last 2 decades of working with patients with compromised hair.
Again, going back to the same question I asked earlier. So you were talking about onion juice. There is amla. So instead of applying it on your hair, does it help if patient just directly eat that?
Eating onion is not going to deliver those actives to your scalp.
Right.
So I don't think that works that way. But amla, yes, because it is a good store of vitamin C, it might be helpful. But then it is not specific for the hair. It is good for overall health.
Right.
See, I feel whatever is good for your body will be good for your hair. So this is a very common phrase I use to tell people who consult me, that eat what is good for your body in a wholesome manner. Your hair will also benefit from it. It's a very practical suggestion. There is no specific diet. People ask me all the time, what should I eat? And even I see these recommendations coming from other, on the internet and all that eat this, eat that.
Right.
But it doesn't work like that.
Okay.
You have to have a holistic approach to your food intake.
Right.
And everybody will have regional preferences, So whatever is common, the way culturally and regionally that you have been growing up and you have been eating the food, I think that is what should work for you. Sometimes there are issues because of certain medical conditions where absorptions may be an issue, or the intake of iron and protein may be low. Then you supplement it. Otherwise, you don't need a specific diet for
Diet for hair. Right. So, sir, if someone notices, signs of hair fall, what is the first step they should take?
First of all, I would say if it is just they are shedding more hair than usual, you can wait for a few weeks to see. Most of the time it reverts back to normal. So there is nothing really to worry. Once a hair is shed, it technically grows back, but it may take a few months for it to start growing back. And hair grows at the rate of a centimeter a month approximately, about 0.3 to 0.4 millimeters every day. So for your length of hair, it will take a year and a half for that hair to start growing and then reach that. So sometimes if they've had shedding, like, they are recovering from fever or some illness, or had a, low iron store and they have now replenished. So you don't see an overnight change. So they always say, see, my plait is like half the volume what it was. I say, you have to be patient, because what starts growing today will take a year and a half for you to feel that volume, adequate to what it was earlier.
Right.
And generally, there is something, that I had read across in one of the articles, that after the third decade of life, with every decade, you have about 5% drop in the volume with every passing decade. So that up to 30, it is always an ascending thing. But after 30, it tends to drop. And that is something that one should be aware of. You are not going to have thick hair all your life, but you can maintain it reasonably.
So one more question is that in India, people usually hesitate to go and see a, hair expert. Why do you think that happens?
There are two things. One is that today, with the access to social media and self-proclaimed, experts on social media, they feel that this advice can be tried before they actually go to a doctor. And it's a shot in the dark. It may work, it may not work. But sometimes it can have a negative impact, and the patient actually develops a negative response or an adverse response to whatever has been, they see on the social media, or they may delay getting treated for the actual problem. So this is what I have seen in practice, and I feel that if it persists beyond a few weeks and that shedding is going on, then you need to address it, because it may be a sign of something underlying.
Right.
Something like the person may be having iron deficiency or some other issue which needs to be seen and assessed.
Right.
And a diagnosis of whether that person is having hair loss or hair fall can be clearly ascertained. And if a person can evaluate the scalp using a trichoscope, we have a magnifying aid with
Right.
which we can see the scalp clearly and the hair. It gives a lot of information to us as to where the problem is. And then having the patient go through some tests like the blood tests, it gives us a clear picture of where we could be, intervening. And in a way, have connection between cause and effect, and then treat the cause.
Right. So, I have seen a lot of new, I won't say treatments, but new gadgets, like on social media, which they claim that, it helps with hair fall. So, I'll just say a few names.
If you know any of the gadgets, then tell me, I will explain it to
Yeah, so one is Derma roller.
you.
So, does that actually help with hair fall?
See, what happens is Derma roller is something that is a cylindrical, device which has got pins all over.
Right.
And you tend to roll it with a pressure on the skin. It creates small punctures on the skin. And the logic behind this treatment is that it upregulates growth factors there.
Okay.
The point is, this has been used, and it is used in parlors and salons,
Right.
and patients do it like DIYs, they do it at home. But in some patients, this can actually be detrimental to their scalp health, because you are puncturing the skin on a day-to-day basis
Right.
in the hope of upregulating the growth factors. It doesn't usually happen, and there is a part when beyond that, this will just not work. And I am of the opinion that do not injure the scalp in the hope of getting these growth factors, because that could be a temporary response to that injury that you are creating. And though there have been published studies, but they are again very small, sample sizes and evaluated for a very small duration.
Exactly.
Now imagine a problem that is going to be for the entire life, and you do this. Is it feasible to do this for your whole life?
Right.
And if you stop it at a particular time, what was the benefit of having done it in the first place? So that logic is not there. These are all these stopgap arrangements that have come up in the recent, the way the whole field has evolved. There is something that is known as micro needling, which they keep making these. It is not universal that everybody gets a response. A small fraction of patients may see some improvement, but that is only for some time. After that, if you don't do anything further, that response is going to go down.
Right.
So the point is that injuring the scalp is something that I do not agree to, or a problem that is essentially genetic in nature.
Right. And what about there are these devices, red light, blue light devices?
Okay, now this is very important to understand. Light in the wavelength of 650 to 680 nanometers, the wavelength there, that is mostly in the infrared spectrum. That light is known to penetrate the skin for a few millimeters.
Okay.
The interesting thing is that this wavelength was originally used to heal non-healing wounds. It worked in those wounds because it
Right.
made certain changes. Now, they did a study on this, and it has been there. It is known as low light devices. So they are also called lasers, but they are not actually lasers. They are essentially the light in this wavelength, and this tends to increase. There is a hypothesis as to why it works. So there are, all our cells have batteries. These batteries are mitochondria.
Okay.
These are small organs inside each cell. So they stimulate the mitochondrial activity. So the battery gets recharged. The hair becomes a little better.
Okay.
Now, whatever studies have been published in type 1, 2 and 3 skin. These are basically the Caucasian kind of skin.
Okay.
So there are very few studies on our type of skin. Second, even the guidelines that were set up, they do not have any way to predict whether this should be used beyond 6 months. So, moreover, whatever we have seen in published data and also our clinical experience, that it is not a foolproof technique that works. I would not encourage something like red light, blue light. The data is very clear on this specific wavelength of light, 650 to 680 nanometers. And that has found to be effective in improving hair quality in a clinical trial. But its safety beyond 6 months of usage, we do not have that data.
That data. Okay.
So there are people who wear these caps with those lights. They have these diodes inside. They have helmets. Now this thing is not practical because you cannot do it every other day for the rest of your life. And moreover, there is no study that has looked at even beyond 1 year. I need to have data. If I'm going to make the patient do something beyond 1 year, how safe is it? And what are the other implications from this? That is not known to us.
Right. So, sir, are there any new advancement in hair regrowth science that people should know about?
Actually, in the last decade or so, I don't think anything that promising has come up. There's a lot of talk about a regenerative field coming into hair loss management. But you must understand that this field does not have long-term data to look at the safety and effectiveness of these treatments. Even laboratory culture of hair follicles, which started maybe a couple of decades ago, looked very promising at that time, but couldn't deliver because they just couldn't go over the initial stumbling blocks of culturing an entire human follicle in the laboratory and then implanting them into the skin. So, unfortunately, there is nothing that looks very promising. But from whatever understanding I have of the hair follicle, the key to the life of the hair follicle is the signaling between the two sets of stem cells in the hair follicle. And the signaling that exists between these two sets of stem cells actually decides the whole future of these hair follicles. And unless some work is done on that, I don't see anything that is promising, that is safe, and that has significant validation in terms of long-term safety. I don't think there is anything new on the horizon at the moment.
Okay. So, sir, what is one hair care tip that you wish everyone knew about?
Unfortunately, there is no one hair care tip, but I would say that maintaining good scalp health will go a long way in maintaining good hair health. Now, this is something that comes from, like I said, maintaining that ecosystem on the scalp and use of regular cleansing agents, which are formulated to be safe and which maintain this ecosystem on the scalp without harming it. Regular washing of the scalp may go a long way. Combine this with a good lifestyle, which includes healthy diet. Now, you cannot, like I said, what is good for your body is good for your hair. So, healthy diet and adequate sleep.
Right.
It goes a long way in the way your hair will look and feel.
Right. I have one last question. I see you have amazing hair. What is your hair care?
Nothing, it is just genes. I don't think there's anything I can say. It is the way I've inherited genes.
Okay. So, sir, thank you so much for this episode. We all of us had fun with it, and everything that you have shared is amazing. So, to everyone who is watching, if you have any questions, do let us know in the comments below. And don't forget to like, share, and subscribe.
Thank you for having me, and thank the entire team of Beyond Skin
Thank you so
for
much for
this
coming, sir.
invite and for this podcast. Look forward to seeing you all again.